Today, we're diving into a really fascinating connection between a totally natural compound that's already in our bodies and one of the most groundbreaking cancer treatments out there. We're going to look at how a key player in anti-aging science might just be the secret to making our best cancer therapies even better. Look, immunotherapy has been nothing short of a miracle for so many people. It's a true game changer. But there's this frustrating question at the heart of it all. Why doesn't it work for everyone? For way too many patients, it just doesn't. Or it works for a while, and then it stops. And that is the question researchers are racing to answer. The core problem is something called treatment resistance. And you can think of it like this. Cancer cells are incredibly sneaky. They can actually learn to put on a disguise, like an invisibility cloak. So they become invisible to the very immune cells that are supposed to be hunting them down. This lets them hide out and keep growing, even while a patient is getting the most advanced therapies available. So where do you even start to look for a solution to that? Well, sometimes the answer comes from a place you'd least expect. In this case, researchers started following a clue that came not from a cancer lab, but from the world of anti-aging science. And they zeroed in on one particular compound that seems to make a really remarkable difference. So let me introduce you to alpha-ketoglutarate, or just AKG for short. Now, I know it sounds super scientific, but it's a completely natural keto acid our bodies are already making every single day. And it's absolutely crucial for tons of our biological processes. You might also see it called 2-oxoglutarate. Don't worry, it's the exact same thing. And here's the really interesting part. AKG isn't some brand new discovery. It's already pretty well known in the anti-aging world for how it supports the health of our mitochondria, our kidneys, even our muscles. I mean, it's so fundamental that our bodies make it when we break down everyday foods like dairy. Okay, so to really understand how a compound known for anti-aging could have a huge impact on cancer treatment, we've got to shrink way, way down to the cellular level. It really all comes down to these tiny little engines that are powering our bodies. And the key players here? The mitochondria. You probably remember these from high school biology, right? They're the power plants of our cells, and that's literally what they are. They take the food we eat and they convert it into the energy that every single one of our cells needs to do its job. But here's the sinister twist. In your healthy cells, mitochondria are these super efficient, powerful, well-organized engines. But cancer can actually hijack them. It corrupts them, makes them weak and dysfunctional, and it rewires them to actually help fuel the tumor's own growth and survival. And this is where AKG comes back into the story. The very research that made it a big deal in anti-aging shows that AKG can help rejuvenate these little cellular power plants. It seems to help re-regulate them, basically giving them a full tune-up to get them back to their normal, healthy state. Okay, so that's the theory, right? Healthy mitochondria are good, and AKG helps keep them healthy. But does that actually make a difference for real cancer patients? Well, let's take a look at the actual evidence. So researchers went back and started analyzing data from these huge clinical trials. They weren't testing AKG on purpose, but they were looking at the natural levels of it in patients who were already getting immunotherapy. And what they found was this incredibly clear and, honestly, surprising pattern. In melanoma patients, the results were just wow. When they sorted patients based on their natural AKG levels, the group with higher levels responded significantly better to the immunotherapy. The difference was just night and day. And then in kidney cancer, the findings were even more dramatic. A similar analysis showed that patients with higher levels of AKG in their tumor tissue had treatment responses that were approaching twice as good as those with lower levels. I mean, that is a massive, massive difference in clinical setting. And this isn't just a fluke in one or two types of cancer. We're now seeing similar patterns emerge in research on other really tough-to-treat cancers. Studies on lymphoma and triple-negative breast cancer are all starting to point toward the exact same conclusion. Higher AKG levels seem to be linked to better outcomes. So the billion-dollar question is, why? Right? How could a simple, natural compound have such a profound effect? Well, researchers think it all comes down to AKG's ability to help the immune system see the cancer it's supposed to be fighting in the first place. So here's the simple version of how they think it works. Step 1, tumors create that disguise we talked about earlier, that molecular shield to hide. Step 2, AKG seems to disrupt that shield, essentially ripping off the tumor's mask. And finally, step 3, once that tumor is unmasked and visible, the immune cells, which are already revved up by immunotherapy, can finally recognize their target and go in for the attack. So, what do you do with all of this? The point here is absolutely not to run out and start buying supplements. No, the whole goal is to be informed, to be empowered for what is probably the most important conversation you can have, the one with your doctor. So let's just boil it all down. 1, we know that immunotherapy resistance is a huge challenge. 2, we've seen solid data linking higher natural AKG levels to way better patient responses. 3, the leading theory is that AKG helps unmask those sneaky tumors. And 4, and this is important, this is all centered on a natural compound our bodies already know how to make and use. Now, I have to be crystal clear about this next point, okay? Nothing we've talked about here is medical advice. Please, this information is meant to be a resource, something to help you have a more active, more engaged conversation with your oncology team. They are the experts, and they're the only ones who can guide you on what's right for you. All this research really leaves us with a pretty powerful question, doesn't it? By better understanding and maybe even supporting the natural compounds and processes that are already at work inside of us, we might just find the next great leap forward in cancer care. It really suggests that sometimes, just sometimes, the answers we've been searching for have been right inside of us all along.